Again, I'm Cheri, and this is Crystalyn. We're going to be talking to you about nursing, health sciences, and emergency medical services options at Kapiʻolani Community College.
All right, so within the nursing department, we have 3 different levels of nursing. We have the entry level, which is nurse aide, and then we have the middle level of nursing, which is the licensed practical nurse, and then we have the registered nurse, which is the top level of nursing. So we offer all 3 of these here at Kapiʻolani Community College. So the nurse aide, the entry level, they provide the basic care by assisting patients with bathing, eating, toileting, turning and positioning patients. They take the patients from the, with walking and transferring from the bed to the wheelchair. They take vital signs. They do all the basic patient care when somebody can't take care of themselves. We run this program as 8-week course. It's 150 hours. Once the students graduate, they can sit for a certification exam to become a certified nurse aide. The exam is offered through Prometric. There is a big need for nurse aides in hospitals, long-term care, and home care. There's a big demand for nurse aides. And they start about $12 an hour, working their way up to about $18 an hour with experience. So again, that's entry level. Then this middle level of nursing, licensed practical nurse. This is a 1-year program once you get in. Licensed practical nurses perform different medical procedures. They work under the registered nurse or the doctor. They do some medication administration. They monitor the patient's response to those meds. They do the vital signs, and they also maintain the patient records and assist with the patient care planning. So once the students graduate, they get a certificate of achievement. They are able to sit for the NCLEX PN Board of Nursing exam to become a licensed practical nurse. There is a big need for LPNs in the community. They are being hired in clinics like Straub Clinic, Kaiser Clinics, and long-term care and home care. They start at about $20 an hour and work their way up to $28 an hour. And then the registered nurse, this is our most popular program, the associate degree in nursing. They do the other duties that nurses do, but they also do more highly specialized treatments and work in a variety of settings like the operating room, emergency room, intensive care. They also manage the care of their patients, and they teach them. So when the patient has to go home, if they have a special diet or if they have wound care, they teach them and their families how to take care of themselves at home. They also supervise the LPNs and nurse aides and help problem solve issues. And they work as a whole team in the hospital. They work with the doctors, they work with the other nurses, they work with the occupational therapists, the physical therapists, the social workers. So they work as a team to take care of the patient. And so those are the 3 different levels of nursing. The registered nurse is a two-year program once you complete the prerequisites and are accepted into the program. So I'm gonna let Cheri now talk about the health sciences programs. Oh, sorry. So when, sorry, here, let me just touch. So after the students graduate from the 2-year program, they sit for the NCLEX RN exam, become a registered nurse. And there is a big demand for registered nurses in hospitals and clinics and long-term care. And the salary is about $31 to $45 an hour.
Okay, so I'm going to talk to you about emergency medical services and health sciences. Like Crystalyn mentioned, all of our programs are selected mission programs. And so what that means is that you have to complete a certain series of prerequisite or qualification courses before applying to our programs. So I did want to point that out. As you're looking at different programs, you definitely want to talk with a counselor, whether it be a counselor at your current institution, or you can always contact the health science EMS department or the nursing department to get more help figuring out what prerequisite courses you need to take. If you're participating in the Next Step program, there are some courses such as Health 125. There's a couple of other content courses that may be available in the July 6th session that you could take that will apply as prerequisite courses to all of our programs. So the Emergency Medical Services Program, we offer 2 different pathways. So the first one is going to be the EMT. It's going to be a certificate program. It's going to be 16 weeks or 1 semester. So in 16 weeks, you can pretty much be on the ambulance, helping people as a first responder. So EMTs provide basic and advanced life support to patients in pre-hospital emergency care settings. So they are first responders. They're the first ones on the scene when you call 911. And they provide emergency care such as banding, splinting, CPR, and other life-saving techniques. The EMT program is what we call a career ladder program. So the next step after you become an EMT Typically, students will work for about a year or two, and then they'll come back to school to earn their mobile intensive care technician degree, which is the paramedic degree. So the EMT degree, again, it's a certificate program, 16 weeks, 1 semester. So you'd start in August. By December, you have the qualifications necessary to sit for the National Registry exam. You'd come back 2 to 3 years later, and then you do the mobile intensive care technician program. And that is either a certificate or associate degree. So depending upon what qualifications you want, you can either do a certificate of achievement or you can do an associate of science degree. The mobile intensive care technician program is a 3-semester program. And MICTs learn to provide advanced life support functions in the pre-hospital emergency setting under the direction of a medical doctor. So your EMT would be your entry-level position. The paramedics, the MICTs, are going to be the more advanced. In addition to all of the functions performed by an EMT, the MICTs perform advanced functions such as administering IV fluids, medication, performing endotracheal intubation, recording and reading electrocardiograms, and then they use the cardiac monitor defibrillator. So those are the 2 programs that we offer in the EMS department. And in addition to that, we also have a bunch of health science programs. So the health science programs, similar to everything else, do have prerequisite or qualification courses. And then I have them listed here in alphabetical order. So the community health worker, that's a certificate program. You can earn that in 3 semesters. That's a part-time. The community health worker is our only part-time program. So that's going to be a 3-semester part-time program. And it prepares students to work as outreach community health workers to help disadvantaged populations with existing healthcare resources. Our next program is a dental assisting program. So you can either do the 1-semester or 2-semester certificate program. So again, depending upon the amount of time you have to spend in college, we have a bunch of different varieties of options available for you. So dental assisting program, again, 1 or 2 semesters, depending upon the type of certificate you want to earn. Dental assistants work with the dentists, and so they support the hygienists and the dentists. So they're often the ones who are going to be sterilizing the equipment. They're going to be preparing, helping prepare their rooms for the cleanings. They can be assisting the hygienist with the cleanings, passing the right tools. Basically, they're providing that support for the hygienist and the dentist in the office. Our next program is a medical assisting program. This is a certificate program or an associate degree program. So the certificate runs for 1 year, so it'd go fall, spring, summer. And then if you want to earn the associate degree, you'd stay for another year, and then you would earn the associate degree. So the medical assistants help in medical offices, clinics, hospitals. There's both front office and back office. So your front office medical assistant is the person that you see when you go to the doctor. They typically will check you in. They'll help you with scheduling. They might help you with billing. They're basically the first person that you see when you walk into the doctor's office. They also do back office things. So the back office, they'd be helping with taking your vital signs, so your blood pressure, your temperature, your height, your weight. They can also do basic immunizations. The medical assistant will work under the license of the doctor who employs them. So depending upon where you work as a medical assistant, that'll kind of determine the type of duties that you're able to do. So for example, we have a medical assistant who's working in a plastic surgeon's office. She's allowed to give like Botox fillers and do basic suturing because the doctor who employs her allows her to do that. Okay, so that's going to be medical assisting, again, 1 year for the certificate or 2 years for an associate degree. We also have a medical laboratory technician program. So the MLT program, it's an associate degree program that's about 1.5 years. This program is really interesting because a lot of times students go into the health field and they really want to help people. You know, they like working with people, but every now and then we'll get a student who says, you know, I like working in the health field, you know, I want to help people, but I don't really want to work with people, and that's totally fine. So our MLT program, it does offer you the chance to still be in the health field, still be working with a team, but it's going to be more indirect patient care in that you're working in the lab. You're not working directly with patients. So the other programs we talked about, you have a high level of direct patient contact. You know, in nursing, you're working with the patient on a regular basis, whereas medical laboratory technician, you're more working with your sample specimens. So MLTs are laboratory professionals, and they perform a wide variety of routine laboratory procedures. And so they'll work in both public and private clinical and research labs. And again, this degree, you know, they're working with your bodily fluid samples. So they're still working in a team. They still work very closely with the doctors who are placing the orders. You know, there are other scientists in the lab. But as far as the direct patient care, this is a field in the health program that does have very minimal direct patient contact. Okay, we also have the occupational therapy assistant program. and the physical therapist assistant program. So the two fields are somewhat similar. You know, when you get hurt, you think of, you know, your rehabilitation, right? So say you get hurt, you break your leg. When the cast comes off, your occupational therapist is going to help you figure out how to regain your day-to-day life functions. Whereas your physical therapist is going to be helping you more with your muscle mass, your range of motion, and your mobility. So our occupational therapy assistant provides specialized treatment and learning skills to enable clients to lead independent, productive, satisfying lives. And so they'll work very closely under the supervision of a registered occupational therapist to carry out treatment plans. So again, the occupational therapist is helping you regain your day-to-day life actions. So you broke your leg, say you live on the second story, you know, you have a set of stairs. The occupational therapist is going to help you figure out, you know, what type of tools, what type of support can they provide to help you easily climb those stairs again. Whereas the physical therapist assistant is looking more at helping you regain your muscle mass, your range of motion, and your mobility. So the PTAs work with patients under the direction of a licensed physical therapist and they'll implement therapeutic programs to help, you know, again, regain your muscle mass, range of motion, and mobility. The next program is the Radiologic Technology Program. That's going to be an associate degree program. It's a 2-year program. This is our most popular program. And the radiologic technologists use X-ray equipment to assist the radiologist in examining patients for broken bones, injury, disease, and malfunctioning organs. And then our final program is our Respiratory Care Practitioner Program, and that's going to be a 2-year program as well. And the Respiratory Care Practitioner, it's a physician-directed health science specialty that cares for patients with disorders of the cardiovascular and pulmonary system, so anything to do with breathing. A lot of students who apply to the nursing programs will also apply to the Respiratory Care Practitioner Program as a parallel plan. The nursing programs at KCC, and Crystalyn can talk more about that, are extremely competitive. And so sometimes, you know, you're not able to get in on your first choice. So instead of waiting out, you know, a year or so, sometimes students will also apply to the Respiratory Care Practitioner Program because it is very similar in terms of the scope of duties. With respiratory care, you're still working in a team of nurses and doctors. But for respiratory care, you're only providing the services for the respiratory system, whereas nursing, you could be working with the full body. So those are really quickly the health science and EMS programs. We also have some non-credit programs that are available at KCC. Is there anyone here to talk about the non-credit programs? Okay, so these non-credit programs are different from the credit programs that we just introduced. The nursing, health science, and EMS programs are all what we call 4 credit. So you'll be earning college credit for these programs. You'd earn either a certificate or an associate degree. The non-credit programs are a little bit different because you're not earning college credit. Therefore, you cannot use financial aid to pay for these programs. They're more for short-term training. A lot of them are, because they're not for credit, they do run a little bit different from the regular fall and spring schedule. So they typically will run in the evenings. They have maybe shorter class terms. So instead of going to a 16-week semester, students in these programs may be doing 6 to 8 week modules. And again, these are not for college credit, but they do still give you the training to enter these fields. So we have an advanced pharmacy technician program, the CDHC for dental hygienists, mammography, massage therapy. We have a medical assistant and a nurse assistant apprenticeship program, pharmacy technician, phlebotomy, PUA for dental assistants, and the surgical technology program. If you want to screenshot this is where you can contact us if you have any further questions about any of the programs. I know we have some time for question and answers as well. But for nursing, you can email capnurse@hawaii.edu. It's KAPNURS@hawaii.edu. And the phone number there is 734-9305. And for health sciences or emergency medical services, you can email healthsci, HLTHSCI@hawaii.edu, or give us a call at 734-9224. Due to the COVID pandemic, we're not taking any walk-in counseling appointments at this time, so we do encourage you to email us or call us, and we'll be able to assist you either through email, through phone, or through Skype. I want to just share one more page with you. Crystalyn, did you want to jump in? Anything else?
Not that I can think of. The 2 programs, the apprenticeship programs, the medical assisting and the nurse aid apprenticeship programs through the non-credit are actually being funded by a grant. It's for unemployed workers, and it's being funded, so the training is free. and they want to get you into fields that there are lots of jobs in. And so the Department of Labor is sponsoring this. They do want you to work for 1 year full-time once they train you as a nurse aide or as a medical assistant. And this will most likely be in acute care, so you'll be working in the hospitals. So it's a great opportunity if you're not working right now, and if you don't want to go on to school right away, you can do these fast training programs and get into the medical field right away and work full-time.
Okay, I'm going to just share the KCC website with you all. So if you do want to learn more about any of the programs that we offer, I believe that we're posting some handouts. So we do have information sessions. So information sessions are a great way for you to learn more about the programs. We have them once a month, and they're free to join. You don't have to sign up. You just click on the links that we have posted. And the program directors or the counselors will be running the information session. So if you have really in-depth questions about what it's like to be an EMT or what it's like to be a respiratory therapist, a nurse, you know, you'll be able to get a little bit more detail at those information sessions. But I'm going to share with you the KCC website. So if you go to the KCC website, kapiʻolani.hawaii.edu, and you hover over programs of study and you click on credit programs, it's going to take you to a list of all the programs that we offer. So all of the programs that Crystalyn and I discussed this morning are going to be found under this credit program tab. And so if you click on any of the programs, so if you were to click on EMT, on the website, you'll find a basic description of each program. You'll find the type of certificate and degree program offered. But most importantly, at the very bottom of each page, there's this forms and documents box. If you have questions about the type of courses you'll need to take, there's an admissions and advising document. If you click on that, that'll tell you everything you need to know about applying to the program. So it tells you any program prerequisites, qualification criteria, as well as application deadlines. So again, that's called the admissions and advising document. And then we also have a listing of all of our information sessions. So you'll want to look at the summer 2020 information session schedule. And again, this is for health sciences and EMS, and I'll show you the nursing one in a bit. But for summer 2020, this has a listing of all of the different information sessions that we offer. We do offer them once a month. Again, there's no fee to join. You just sign up. You don't have to RSVP. Just click on the link, and then that'll take you to the appropriate Zoom session. So the two things you'll definitely want to take a look at: the information session schedule, admission and advising. And then when you're ready to apply, we do have applications available online as well. For nursing, Crystalyn, do you want to share your screen?
So this is our most popular program, Registered Nurse Preparation. It's the Associate Degree in Nursing program. And just like Health Sciences and EMS, it gives a program description and talks about the admissions procedures. But on the bottom in the toolbox is where you find all of the forms down there. And we also have nursing information sessions. And ours right now with the COVID are all videotaped. And so we're not doing any in-person at the moment. But if you scroll down here on this screen, there's video links on each of these. They're little YouTube videos, and you can just click on any one that sounds interesting. We broke them apart so that they're not overwhelmingly long. I think they range from 2 minutes to about 8 minutes, and it goes through all of the different admissions procedures, the prereqs, the co-reqs, as well as what it's like once you get into the program. So feel free to look at those videos. And if we go back out of here, then we can see, we also like EMS and health sciences, we have the ADN self-advising form. And this gives you the breakdown of, on the top here, it has the fall and spring application deadlines right up here on the top in the boxes. And then it tells you the prerequisite, fall and then spring. And then, so those are the times when you're gonna apply to the nursing program itself, not to the college. You apply to the college as a liberal arts student, and you take these prerequisite courses in order to apply to nursing. So you have to complete all of these prerequisites with a grade of C or higher, as well as a pre-entrance exam called the ATITs. And that's what's needed in order to put in an application to the ADN program. And like Cheri mentioned, it is selective admissions, thereby we take the top applicants. We get about 150 applications from anywhere from 12 to 24 spaces each semester. And we are aligned with UH Manoa, so our students can go on to Manoa after our 2-year program and complete 1 more year full-time of nursing to get a bachelor's of science in nursing. There are a handful of other prereqs that must be done in order to do the last year of nursing at Manoa, but we are aligned with them, and we encourage students to go on and get their bachelor's after our program.
Wow, Crystalyn and Cheri, thank you so much. That was so much information. We do have a couple questions that have come through the chat box. Is there going to be any sonograph or sonogram programs available in the future?
Possibly, but right now, no. We run that program as needed. And so at this point in time, we only have the radiologic technology program as well as the mammography.
Okay, and then another question is, how long do students wait to get into the programs that are not direct entry? How many gen eds do students need to take before getting accepted? I know you said there's a lot of information online, but can you address that question?
It really depends on the program. So for example, like the CNA program, that one
is first come, first serve, actually. That's our only one that's first come, first serve. They just have to show a proficient reading level, and then they're accepted into the program. But the other programs that have more prerequisites, it depends if the student's full-time, part-time, if they get good grades the first time, you know, how competitive they are. With our associate degree in nursing, the most popular program, it's a minimum of 3 semesters because they have to do anatomy and physiology 1 and then anatomy and physiology 2 before they can take pharmacology 203. So generally it's 3 semesters. But again, it depends on their grades and their exam scores because they're competing with all the other students.
Yeah.
So we do try to have them, like Cheri mentioned, create a parallel plan in case they don't get in, and to look at what else they can take. They can also do the other prereqs for the bachelor's degree during the time when they're waiting to reapply if they didn't get in.
Okay, I have an extension to the sonogram question. Can you take, is there anything you can take after the RadTech degree to learn the machinery for ultrasounds?
There are programs in the mainland. The radiologic program is the only program in the state. So a lot of students will either get hired and then do on-the-job training, or they will go away to the mainland. There are some online programs as well, but you still do need to go to the mainland for the hands-on training to learn the ultrasound equipment.
Wow. Okay, and then let me see. What is the job market for EMTs coming out of the program?
Right now, it's very, very good. For city and county, it's very, very good. They are understaffed, and so each class that graduates, those, we're always able to get them placed. If you're looking at the neighbor islands, it is a little bit more challenging because it's private run AMR, and so they don't hire as many full-time employees there. But if you're looking to be employed with city and county, the chances are very, very good because we are the only training program in the state, and so we do have a very close partnership with them.
Can you guys just maybe briefly touch on quickly any changes in pertaining to the COVID for the classes for fall?
Application procedures are a little bit different. We're not doing as much in-person counseling. As far as the classes go, the clinical portions, we're trying to get students out to complete their clinicals as soon as they can. However, depending upon what happens with COVID in terms of the hospitals allowing us back into them, they may be delayed. We are working very closely with the hospitals and the various partners we have in the community to make sure that we can get our students graduated. However, if there is a second wave, we don't know what that's going to look like. So that may be something that impacts them. We're doing social distancing in the classrooms. All of our programs are very hands-on, as you can imagine. So it's definitely looking a little bit different, but we do anticipate taking in, the regular classes in the fall semester.
Thank you very much and have a great day.
Thank you.
Bye, thank you.